It's my pleasure to welcome you to the Surgical Services Department at Robert Wood Johnson University Hospital, Hamilton. This short video will give you an overview of what to expect on your day of surgery. The pre-operative nurse will call you the business day before your surgery to let you know what time to arrive and review medications that should be taken the morning of surgery. Please take the opportunity to ask any questions or to voice concerns you may have. On the day of your surgery, you must first go to the registration area located in the Outpatient Services building. There you will be registered for your procedure, and then you will be directed to the Surgical Services area and be seated in a waiting area. A pre-operative nurse will come to greet you shortly thereafter. The pre-operative nurse will escort you to the pre-operative area to start preparing you for surgery. Expect to have your vital signs taken and your IV will be placed at this time. Your medical history and paperwork, including surgical consent, will be reviewed with you. The anesthesiologist will also talk to you in the pre-operative area prior to your surgery to discuss how you will be kept comfortable during your surgery. The type of anesthesia that you will need for your surgical procedure will be discussed between you and your anesthesia provider. Prior to going to your prepared operating room suite, your operating room nurse will come to the pre-op area to greet you and review your chart with your pre-operative nurse. Your surgeon will speak with you and mark your surgical site. If there's laterality involved, the right or left of whatever operative site will be marked. When all is ready, you will be wheeled on a stretcher into the operating room. The operating room can feel chilly. Warm blankets will be provided for your comfort. You will be assisted onto the operating room bed. It can seem kind of narrow, so a safety belt, much like a seat belt, will be placed across your thighs as a reminder. This is just one of the many important safety measures that will take place during your visit. There will be several staff members attending to you as you first enter the operating room, and it can seem a bit overwhelming. However, this is just your team that is working together to provide the very best care, safety, and privacy during your procedure. You will be placed on monitors that will measure your blood pressure, heart rate, breathing, and oxygen levels. Safety is a priority in the operating room, and you may notice some of our safety measures such as something called a timeout. The timeout is a safety checklist that you will be a part of. Your team will be reviewing your name, date of birth, allergies, surgical procedure, site of procedure, and more at this time. Please be assured that even though we are performing many functions, you are the priority in the operating room. The operating room team will be communicating with you the entire time. When the surgery is finished, you will be taken to the post-anesthesia care unit, where you will continue to be monitored and cared for by your post-operative nurse. As you wake up from the surgery, you will receive care for a minimum of 1 hour, depending on the surgery. You could be there a little longer too. After sufficient recovery time, you will be moved to an inpatient room, or you may be discharged. Education and discharge instructions will be given to you prior to discharge. For your safety, you must have a ride home with a responsible adult. Thank you for choosing Robert Wood Johnson University Hospital, Hamilton. We look forward to providing the very best surgical care